Good afternoon and welcome to breakout number 4 of the conference. I'm pleased to introduce Shannon Decker. She's the executive director and co-founder of the Speedy Foundation. She has a master's in educational leadership from the University of Idaho and 10 years of experience teaching in Idaho, Nevada, and California. I'll turn it over to you, Shannon.
Great. Thank you so much, Heather. Hi, everyone. It's great to be here. I hope you've been having a wonderful conference. I'm going to be presenting a campaign called Know the Signs, which has been transitioned into a suicide prevention training. My foundation is called the Speedy Foundation. I have been facilitating different programs. Hope Conquers ACEs is one that's based in Idaho. Safe Talk, Question, Persuade, Refer, Mental Health First Aid, Youth Mental Health First Aid, and a peer-to-peer school-based program called Hope Squad are programs that I find very dear to my heart. I am trained in doing psychological autopsy research. I sit as an advisor on various panels, including the Chief of Police's Community Advisory Panel. I actually just stepped off of that this month. Nope, at the end of last month. We're in the middle of June now. And had a pleasure working with Chief Bones and Chief Lee and learning how to take some of what I was working on in the field of mental health advocacy into the community of Boise. I also advise the United States Olympic and Paralympic Task Force in the mental health realm. I'm on the Idaho Violent Death Reporting Systems Advisory Board. And then I'm also, I'm physically based in Truckee, California. I'm from Boise. I spend a lot of time in Park City, Utah, and I have this little triangle set up of doing suicide prevention in those communities. And so I'm also on the steering committee of that local coalition. I do a lot of collaboration with other agencies all across the Rocky Mountain West. The Speedy Foundation's mission is to advocate to prevent suicide, to promote conversations to end stigma, and to support mental health education. So everything that we do fits into those 3 buckets. We will be turning 10 next month. We were formed in 2011 in memory of my cousin, Jeret Speedy Peterson. He was an Olympic freestyle aerialist. He medaled at the Vancouver Olympics and spent, his life really trying to be of service to others, especially children. He spent a lot of time speaking to the media about his struggles with mental health. He talked about adversities that he faced as a child without ever understanding the reality of trauma and without that background knowledge of the ACEs study. And so it was risky and it was unexpected and it was looked upon as very strange. He struggled with substance use and addiction and ended his life after getting a DUI in the Sun Valley area. We use his story with the knowledge that he was already talking publicly about his struggles with mental health. We do so with permission from his mother and sister, as well as our group as a board. I've got a 30-second promo that he put together before the Vancouver Olympics, and this was truly how he spent most of his time. This is the level that he was at most of the time.
I have an unfilled dream. I missed it just by a little bit. I tried everything I could. Medal or not, I get to walk away never saying what if. Bones heal and bruises go away. Quitting lasts forever. I have one chance to make it happen.
So I share that video because when he wasn't at that level, it was flat on the ground. And he really struggled because he never had an accurate diagnosis. As we look back at his medical records at this point, all signs point to bipolar disorder. And had treatment, had diagnostics, had the stigma around mental health been different 10 years ago, perhaps he would have had that diagnosis and perhaps he would have had access to treatment. But a lot has changed. I think that if you're, reading the news and you've seen anything about Naomi Osaka and the French Open, that's got a lot of what's going on behind the scenes, at least for us, with athletes and preparing for the Olympics, and working for athletes to be able to advocate for themselves. Now, that mentality that Speedy shared, that's what it takes to get to, a podium at the Olympics. That's what it takes to get through boot camp. That's what it takes to get through medical school and through childbirth. But we can't sustain at that level. And that's why fostering resilience is just so vitally important to all of us across the lifespan. So while we are on this slide, what I'd like for you to do is take out your cell phone, because we've got some phone numbers to program in if they're not already there. So while you program some new phone numbers in, I will explain. As far as conversation goes, one of the first things that we did when Speedy passed was we were approached by Mayor Beater, the mayor of Boise at the time, and he said, "Did you know that Idaho is one of only 2 states that does not have a suicide prevention hotline call center?" The other was Wyoming, and Wyoming received their hotline call center last summer. So between 2011 and 2012, the Speedy Foundation acted as the funding mechanism to launch the Idaho Suicide Prevention Hotline, which was then handed over to Mountain States Group, which is now Janus. And we advocated again in 2016 for the state legislature to start funding the hotline. We formed the Idaho Suicide Prevention Coalition, and that happened. And the suicide prevention program within the Department of Health and Welfare was also founded that year. So we do a lot with setting up booths in unusual places at World Cup ski events, and places where you're not typically, thinking you're going to be talking about mental health or suicide prevention. Focused on storytelling and offering presentations. We've been involved in film screenings and community panel discussions, and we hosted a conference at Boise State called the Western States Conference on Suicide for a couple of years. So the phone numbers here, the National Suicide Prevention Lifeline number, 1-800-273-TALK 8255. That is nationwide. It's free. It's 24/7. When you call, it will say press 1 if you're a veteran. And if you press 1, it'll roll you over to the Veterans Crisis Line. Otherwise, when you stay connected, it will roll you over to the call center that's connected to your area code. So while I live in California, I still have a 208 area code. And when I call that number, because I call it often, it rolls me to Idaho. Idaho also has a local 208 number, 208-398-4357. That is a phone number that you can call or text. You cannot text the 1-800 number. Nationwide, there's also a crisis text line, and that number is 741-741. We know that different populations prefer conversation on the phone versus texting. Younger generations are very poor sometimes with making phone calls. And so having that text line is also vitally important. I typically have people use that 1-800 number, but knowing that it's going to roll you to the area code that's connected to your phone is what's important here. I think it's also important to know that you don't have to be suicidal to call. Oftentimes people come to me and they'll say, here's what's going on. My dad has retired. He and my mom have divorced. He's withdrawing. He won't interact with the grandkids. I'm really scared. I don't know what's going on. And I'll say, my background is education and I don't know what's going on either. But what if we both call the hotline? Let's call them together. We'll put them on speakerphone. Let's share what you just shared with me, and let's come up with a plan of action. So I highly encourage you have these phone numbers in your phone. It might not be for you and it might not be for now, but someday these phone numbers can help save a life. So the other thing that we're going to need for this presentation is just a piece of paper and a pen, or you can take your cell phone and use the notes section. We're going to do a little bit of trivia. So throughout the presentation, I've got about 2,750 points out there. And we will come up with a great prize for the winner. This first question is worth 200 points. And the question is, in 2017, the musician Logic released a song featuring the National Suicide Prevention Lifeline number. What was the name of that song? So in the chat box, if you guys have any guesses, please feel free to throw them into the chat box. You'll use your paper and pen to just record your points. Any guesses? That 1-800 something? Good guess. 1-800-273-8255. All right. Now we're going to be using the honor system. So you're going to be keeping track of whether you got this right and your points. So the answer is 1-800-273-8255. The title of that song was the National Suicide Prevention Lifeline. These skilled, trained counselors are available 24/7 to talk, to answer questions, and help people navigate suicidal crisis for themselves or someone they're concerned about. We're never alone. It's wild how many people know that I've been doing the Speedy Foundation for 10 years. They know that there's a phone number. They don't have it programmed in their phone. I had a friend from the Bay Area call me yesterday and say, I'm scared. I don't know what to do. This other person in my life is really struggling. We put the phone number in their phone and let them take it from there. So this is always a resource that it just blows me away that it's not more readily available. And in many school districts, they're starting to put that phone number on the back of student ID cards as a resource. Now, next July, throughout the United States, that number will switch over to a 3-digit 988. And there's more to come on what that will look like. But the idea is that we can elevate 988 to be on par with 911, so that 911 is for physical health emergencies and safety, and 988 is for that emotional and mental health emergency. As far as advocacy goes, we've been involved with a lot of different entities throughout the Rocky Mountain West. We helped found the Idaho Resilience Project and update Idaho's suicide prevention plan, and House Bill 634 back in 2018 to update model policy in the state of Idaho through the Department of Education. Many of the trainings that I know and love, we will come back to these again later, but I want you to know that QPR is now free and available online anytime, either through the Department of Education or through the Speedy Foundation. And the Speedy Foundation is just getting ready to launch some additional mental health first aid trainings throughout the summer. So really quick, in your chat box, I want you guys to do a quick check-in. You've been at a resilience conference for a day and a half. How are you feeling? Bright and sunny, feeling a little stormy, feeling sunshiny and rainbows, a little cloudy, partly cloudy. We got a 1 and a 6, a little cloudy, 8, lots of 8s. Okay. 1s. Okay. Awesome. Well, I know that this is not a sexy topic. I know this is a hard, difficult topic. Most everyone has been touched by suicide in some capacity. So I just encourage you to take care of yourself. If this isn't your cup of tea, please feel free to take a break or to go, circle about. But take care of yourself. And if anything comes up throughout this presentation, it's a great opportunity for you to check in with a counselor, with a trusted friend, or maybe with the hotline yourself. We're going to talk about suicide prevention as a whole. We're going to review the Know the Signs campaign. We're going to look at some data and research. We'll talk risk factors and protective factors. We're going to talk about how do we find the words when we're struggling with someone who might be in suicidal crisis. How do we find the words? How do we reach out to them and connect them to safety? And then I'll have time for questions and a call to action. So when it comes to suicide prevention, we think of it as a stream. We use the stream analogy where there are a lot of opportunities far, far upstream at the source of where the water is running for prevention. We can build a lot of community and individual prevention measures to ensure that our family members, our friends, our citizens are protected from suicide. There's a bulk of work that needs to take place upstream. There also needs to be intervention because sure enough, even with our best efforts, there are still people who can slip past and come to this point in the creek where there is a fall. The intervention can be life-saving. It's like pulling people out, pulling them out, throwing them to shore. And unfortunately, sometimes the interventions get missed or sometimes they're unsuccessful. And postvention would be the response that we have after we lose someone to suicide. This is a cycle. Some of the best prevention work that can be done is in a postvention response. And so we think of this as a cyclical intervention model. to ensure that we have resources in place all across our waterways. Gatekeeper trainings. The Speedy Foundation has a mission to have a gatekeeper trained in every home and in every organization. And so what is a gatekeeper? Well, according to the National Strategy for Suicide Prevention, it's a person who's in a position to recognize crisis and the warning signs that someone may be contemplating suicide. Gatekeepers are parents, their friends, their neighbors, their teachers, ministers, faith leaders, doctors, nurses, office supervisors, squad leaders, foremen, police officers, advisors, caseworkers, firefighters, just anyone who's strategically positioned to recognize and refer someone who's at risk of suicide. Idaho has an updated state suicide prevention plan. We worked on this in 2018, and it was launched with a very ambitious goal of reducing Idaho's suicide rate by 20% by the year 2025. And throughout that prevention plan is this concept of saturating communities, saturating industries with gatekeeper trainings. All right, so get your pen and paper ready for your points. Here's our question. Can you name a suicide prevention gatekeeper training? Oh, well, I think everybody gets 300 points here. I went too fast. So some of those include QPR, Safe Talk Assist, Signs of Suicide, Cognito, Talk Saves Lives. Assist is a 2-day training. It's very powerful. If you are working with clients who are suicidal, it's a wonderful one to take. Janice, which operates the suicide prevention hotline in Idaho, offers those. And it's what all of the volunteers who answer those calls are certified in. So I definitely recommend you taking some time to either spread information about gatekeeper trainings or to take one that is a lot more in depth than what we're covering here today. Today we're covering Know the Signs. This is California's public awareness campaign. It is something that was created. It's been modified into every language imaginable in the state of California. And the campaign itself has then been modified into this gatekeeper program. So the gatekeepers listed here are all evidence-based and some come with some big price tags, whereas Know the Signs is an evidence-informed training. It is not evidence-based, but it is free and readily available. So here's our next question, and I promise I won't click too fast. The question is true or false. Asking someone if they are thinking of suicide will put the idea in their head. What do you think? You guys can put your answers in the text box. True, false, 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 fake, false. Great, thank you. This is a huge stigma. The answer is false. But oftentimes people don't want to ask directly about suicide as they're afraid. They're afraid that they're going to plant this idea into someone's head or perhaps make the situation worse. But the fact is that, that talking about suicide doesn't put the idea in their head. Typically, they feel relieved. When we ask someone directly as possible, are you thinking about suicide? The word suicide establishes that you and the person at risk are willing to talk about the same thing. If we were to say, are you thinking about hurting yourself? The person who is suicidal is thinking to themselves, I want to end the pain. The idea of suicide isn't something that they consider to be painful. They're already in excruciating emotional or sometimes physical pain. And so the more we can talk about things directly, the better. Here's our next question worth 100 points and perhaps a bonus point as well. When do we celebrate Suicide Prevention Week? May was Mental Health Awareness Month. And we also celebrate, as a nation, Suicide Prevention Week. Does anyone know when that takes place? You can put that in the chat box. September 5th. September through the 11th. Awesome. All right. Suicide Prevention Week is the Monday through the Sunday surrounding World Suicide Prevention Day in September. So if you had September, give yourself that 100 point. Now, when, for 50 more points, when is World Suicide Prevention Day? Any ideas? Throw it in the chat box. All right, World Suicide Prevention Day falls on September 10th every year. Nice. All right, so go ahead and keep a tally of your points. And just know that Idaho does do a lot surrounding Suicide Prevention Week. Governor Little has been a huge supporter of suicide prevention efforts, and typically does a proclamation. But there are a lot of proclamations, so wherever you're at throughout the state, having a local proclamation done through your town council or through your mayor is always really good in helping to destigmatize the topic. So for 400 points, pain isn't always obvious, but most suicidal people show signs that indicate they're thinking about suicide. I want you to name at least 3 warning signs. So in the chat box, let's list 3 warning signs of someone who is potentially thinking about suicide. Giving away personal things, being withdrawn, possessions, giving away possessions, giving away those personal, meaningful items. An increased mood. Okay, changes in mood, absolutely. Changes in things that they like, a change in personality, isolation, giving away things, mood changes, hopelessness, sleeping all the time, or not sleeping at all. These are great. There are so many warning signs out there. What we need to really focus on is when we get that gut feeling that something isn't right, let's take that as a sign that we need to further things up with a conversation. Talking about not being around for future events, talking about suicide, gifting things, absolutely. Okay. Here we go. Here's a couple of them. Talking about wanting to die or suicide, looking for ways to kill themselves when they're accessing lethal means, when they're feeling hopeless, desperate, feeling trapped in a situation, when they're giving away those possessions, putting their affairs in order, really reckless behavior, uncontrollable anger, an increase in drug or alcohol use, being withdrawn from friends, family, and other activities that they once enjoyed, anxiety, agitation, changes in sleep, sudden mood changes, or no sense of purpose. I listed that picture in my introduction of me as a 4th grader. I was wearing a little Basque dancer outfit. And I use that picture to put myself back in the shoes of me in 4th grade and to think about all the risks. I had a lot of risks in my life, in my family, and there was a lot going on. But being connected to other people, that was a picture that was taken in my school. I attended Riverside in Boise, and I felt connected. I felt that I had a purpose. And so across the lifespan, no matter where we are, we need to feel connected and we need to feel like we have a purpose. And while I am not Basque, I don't really have any type of cultural connections. I've always been impressed by Basque culture and that sense of family. And so I think that we seek that out. And that's one of those protective factors that can help us. If we have someone who is exhibiting these warning signs, whatever we can do to get them connected back, to anchor them to life, is going to help take them a little bit further away from suicide. If you observe one or more of these warning signs, especially if the behavior is new, I know you guys included some stuff about, sudden changes. If it's increased or if it seems related to a painful event, a loss, a change, please don't hesitate to reach out. Assume that you are the only one who will. So these signs, these are some of the most critical signs when we're talking about teens, and each age population, each demographic kind of have different risk factors, different protective factors as well. But these are the most critical when we're talking about teens. We have loss of interest, personality change, being withdrawn, neglecting their appearance, that sudden mood change, changes in sleep, either sleeping all the time or not sleeping at all, reckless behavior, substance use, giving away those possessions, and physical pain. So those critical signs, when we get a gut feeling, when there's a smoke alarm that's going off, we want to seek help immediately, especially when they're talking about death or suicide. We need to take that serious. If they're seeking methods, and if they are feeling hopeless, if they're not connected, if they feel no reason to live. Talking about it, their statements could be vague. They could be really subtle statements. What's the point of going on? It could be more direct. It could be as direct as I'm going to kill myself. And it could be reflected in something that's written, talked about. It could be posted on social media. We need to take all of these as invitations. Whenever someone is talking about suicide, whether it is direct or indirect, my family would be better off without me. What does that mean? We need to get to the bottom of it. And the only way we can do that is by having a conversation about it. Those changes in mood, I know that you guys mentioned those in the chat. Some of that might be just really uncharacteristically sad, depressed, hopeless. It could be that they're unusually happy and content after that long period of struggling with depression. It could be uncontrolled anger. It could be, acting in ways that just show bitterness and hostility and resentment. And they might also be talking about seeking revenge. Some of the changes in behavior, spending money recklessly, increase in alcohol or drugs, if they stop talking to or doing the things that they once loved. Again, sleep is a huge one, especially when it comes to our youth, and appearing anxious, shaken, or worried. Those expressions of hopelessness and despair, they might not be able to understand how their situation or their life could get better. They could be feeling like they've been in this situation for so long, they don't see the light at the end of the tunnel. Statements, hints at life being pointless, talking about being a burden to others, and just really no sense of purpose. Putting their affairs in order. You guys got this one in the chat multiple times, giving away those prized possessions. Or perhaps when we're talking about these younger generations, they're giving away their passwords, their social media, their gaming personas, online activities. When we're talking about older adults, if they are surrendering their companion animals to the Humane Society instead of to a family member who might catch that as an unusual situation. So it might not be as obvious to us. And that's why training people across society, training our volunteers that are working at the Humane Society, training our after school, care staff of the kids who've got their eyes and ears, on the staff that have their eyes and ears on those kiddos after school, because they're going to be picking up on these smoke alarms, whereas others might be masked. When teens and young adults are complaining of pain, it's often related to their emotions. When they're neglecting their appearance, when they show a significant personality change, that loss of interest, that loss of anchoring to life, and what we are seeing them portray in social media. These are all warning signs. So here is a question for 200 points, true or false. Suicides are most frequent during the holiday season. What do you think? We've got a false, true, false, false, true, 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 true. Okay, false. All right, go ahead and record your points. The answer is actually false. So data shows that suicide rates are often lowest in the holiday months. Suicide is a complex behavior. There's a lot of factors that likely influence seasonal differences in suicide rates. What we've come to understand is that, during the winter holidays is a time where people feel connected, and that winter time is often a time where we're significantly depressed. If we're thinking about some of the communities throughout Idaho, where we might have kind of that layer of cloud that just kind of comes and settles in, and we've got inversion taking place, we can be very depressed. And so for some people, it's not until they start to come out of that depression, they have more energy to make a plan and to act upon that plan. And so that's one of those myths that we can help to destigmatize, that sometimes we think about people, we reach out to people during the holidays to make sure that they feel connected, and then that stops. And so we just encourage that if you are concerned about someone, and it's great to reach out to them during the holidays, but reach out to them constantly. Put a note on your calendar so that you are reminded to reach out and to check in. Okay, here's for 300 points. What does AFSP stand for? Any ideas? You can throw it in the chat box. All right. American Foundation for Suicide Prevention. Kim, wonderful. This was established in 1987. It's a voluntary health organization that gives those affected by suicide a nationwide community. It's empowered by research, education, and advocacy. They have got some incredible resources. And so the data that we're going to go through, I'm using their infographics. So some of the national data in the United States, this is published in 2021. This data becomes published in 2021, but it's 2 years old. So this data comes from 2019 from the CDC. So I really just like AFSP's materials. I've got racks of materials in my office. It's user-friendly, it's easy to digest, and they bring a lot of comfort. So if you're looking for resources, they're a great place to check. The Department of Health and Welfare also has some resources. If you go in and search for in their store, you can order materials there as well. But in the United States, we lose about 47,000 Americans by suicide each year. It's the 10th leading cause of death. Across the nation, it previously was the 3rd leading cause of death for individuals aged 10 to 34, but it is now the 2nd leading cause of death. And when we look at some of the rural states around us, in some of those areas, it's now the 1st leading cause of death, like in the state of Utah. There's a lot of facts and statistics here, but men do die by suicide more often than females, whereas females are more likely to attempt suicide. We estimate that for each person that is lost to suicide, there are 25 people who attempt suicide, and most of those attempts do not go with any type of treatment. There's a huge cost to the United States in suicide as well. And so when we're talking to legislators, that's a piece that really resonates with them. What is the actual dollar cost? This is looking at the suicide rate per 100,000 in population. So when we look at that Rocky Mountain West, it's deep, deep blue. The not so sexy nickname for this is the suicide belt, where our suicide rates are significantly higher than throughout the rest of the country. And looking specifically at Idaho, can anybody tell me what's wrong with this infographic? In the chat box, do you see anything offhand? Montana logo. Is it Montana or Iowa? It's definitely not Idaho. And I don't know who updated these infographics, but I've alerted them to the fact that that is not Idaho. It is, suicide is the 8th leading cause of death in our state. It is the 2nd leading cause for ages 10 to 44. We rank 9th in the US. Suicide by firearm is 87.45 in our state. When we look at suicide rates with firearm throughout the nation, that's at 60.29. And as recent as last year, I recall that number, that percentage rate in the US being significantly lower. But that's one thing that kind of brings us together in these rural states, is that we do have a different firearm culture than the Midwest does, and that the coasts have. It's something that sets us apart. It doesn't mean that we are any more likely to be suicidal. It just means that we have access to a more lethal means to attempt suicide. Yes, we do have a higher rate of suicide than the nation. Thank you, Misty. So there is some great data through AFSP when you're looking for those numbers. And you know what, before we go on, I also just want to note that these are numbers, and these numbers were people. These were our family members. These were our coworkers. These were our neighbors. These were 365 Idahoans who died in 2019. And so each one of these numbers has a story, and it was a very complex story. And there is a lot that we can do to help support the people who miss and love them. There's a lot that we can do to prevent this so that we can continue to reduce this number in our state. So our question is, in Idaho, do people die by suicide or homicide more often in a given year? For 200 points, what do you guys think? Please put your answers in the chat box. Suicide, suicide, suicide. Okay. All right. The answer is suicide. So violent deaths such as homicide are a major public health concern in Idaho, and both have an immediate and long-term impact on individuals, their families, and communities as a whole. We're going to look at our 2019 data from Get Healthy Idaho, because we know that every Idahoan has a role to play in suicide prevention. We all need to know the signs, be able to find the words, and then reach out. So from the Idaho Violent Death Reporting System, which has been stood up in Idaho, this is the second year that it's been up and running. Now all counties are required to report in, and with this new advent of data collection in a more sophisticated way, we are able to understand and measure things more appropriately and determine where we need to provide that upstream prevention. And where things are going really well, what can we learn from communities where things are going well? So when we're looking here, like looking at 2019, we had 365 suicides while we had 30 homicides. And when we think about what the media portrays about violent death, how much do we see reported on homicide and violence versus suicide? There are a lot of best practices in reporting from the media. And so that's a completely different piece. But last spring, the Idaho Suicide Prevention Hotline and myself did a training for media. And if you are interested in that, you can find that on our website. We had Governor Little give a shout out and just strong appreciation for the media to do safe reporting. So here we have homicide deaths. We had 30. And if you go to Get Healthy Idaho, you can get into to our data and manipulate it. So I don't know, what your interest is in this, but if you are looking for data, you are able to do a lot of sorts and filters. And as the program continues to be developed, there will be more features and more data that is being collected so that we can truly understand this problem better. When it comes to suicide deaths, here's our 365. You can identify, which region they are located in, their veteran status, their marital status, age, gender. And again, we will start to learn more about that. When we're looking at suicide rates, these are residents of Idaho, suicide rates by age group, you can see that these 15 to 19-year-olds, it's a piece where there's a lot of compassion, there's a lot of prevention, there's a lot of, charge to address those deaths, and rightly so. But when we're looking at the age span in in Idaho, we also want to make sure that we're reaching out to some of these higher risk populations. Age 65 plus is one that's a hard one to target. They're not likely to call the suicide prevention hotline. And when they withdraw, they don't have necessarily their employer or their work community to rely upon. Or if they've lost family ties, those are very hard to build at that point in life. So there's different obstacles to this very complex problem across the lifespan. So again, if you've got questions, please go ahead and hold those. We will get to them at the end. We are going to take a look at Dr. Thomas Joyner's theory on suicidality. This Venn diagram kind of changed everything that I understood. I knew that for me personally, I had never had a desire for suicide. I mean, I've always understood my own mortality, ever since I understood what it took to breathe and eat. And I couldn't comprehend it. It was very hard for me not to just feel a lot of grief and a lot of guilt when I lost not only Speedy, but a lot of friends. And as an educator, I had students as young as second grade who would tell me things like, my family will be better off when I'm gone. And I couldn't comprehend it. And so this Venn diagram is very helpful. Dr. Joyner is an academic, and it's hard to find a very succinct compilation where he can describe this. And so this is an old presentation from the Dr. Phil show, but I think it's worth a good listen. And he's also going to comment about times of national crisis and what happens to the suicide rate during that. So we will listen to part of it, but if you go to YouTube and you search for Dr. Joyner on Dr. Phil, or if you go to the Suicide Prevention Lifelines channel, it can be found there.
Now joining us at this point is Dr. Thomas Joyner, a distinguished research professor in the Department of Psychology at Florida State University. Now, he's written a book called Why People Die by Suicide. Let me say that again, and there's a picture of it up. Why People Die by Suicide. It's not a beach read, I understand, but it is an important, important message. Now, sadly, Dr. Joyner's own father committed suicide 18 years ago. Now, this really moved you to try to figure out how somebody with such a great and productive mind could get in such a dark place as to end their life.
That's right. My dad's death makes me feel honor-bound to not only understand it, but to exact some revenge for it. Something or somebody stole my dad away from me is the way I view it. And so I feel honor-bound to return that favor and exact revenge. Here it's going to be exacting revenge on suicide itself by studying it scientifically, by advocacy, and through clinical and prevention work.
Yeah, and so by helping people understand it, know the warning signs, see what's going on, then we're raising awareness just by having this conversation.
Absolutely.
And that's exactly what these wonderful people are doing down here, because at this point you say that Casey really wanted to make a difference in this world, and you can't just now sit back and not do something given the experience, true?
Yeah, exactly.
I had a lot of the same pain that I think Mr. and Mrs. Brooks expressed, and that pain was strong for a while, but it did lessen. And then after it did, I poured my professional energies into trying to combat this international killer.
And you've made some headway. You figured something out. Dr. Joyner believes that people considering suicide share three traits in a very common way. And the first one is feeling like a burden on other people and that their death will be worth more than their life. Talk about that.
That's right. It's the idea, the mental calculation that my death will be worth more than my life. If you truly believe that, you could see how that would facilitate suicidal behavior. And we've shown in multiple studies that it does indeed do that. Crucially, the person is mistaken in that perception. But the trick is that they don't know that they're mistaken in that perception. They believe it to be true, and it spurs suicidal behavior.
And isn't it true that most suicidal situations and dilemmas that push people over the edge are transient? That if they had just stuck it out, they tend to get better?
Absolutely. There's no question about that. And there's also no question, as you've already alluded to, that there are good, effective treatments that work for the conditions that underlie suicidal behavior.
Yeah. Psychologically, therapeutically, pharmacologically, there are so many things that can give people relief.
Absolutely.
The second common trait that Dr. Joyner talks about is a feeling of loneliness or social disconnection.
If you look through the literature, the scientific literature on suicidal behavior, arguably the single most powerful risk factor of all is loneliness, a feeling of alienation from others.
Yeah, so they just don't feel like they fit, belong, so they're just on the outside looking in, so why not just leave?
That's right.
All right, and the third thing is an interesting thing that he talks about called fearlessness regarding pain, injury, and death. People considering suicide have learned to overcome these natural fears, and you say that that's more common than cowardice or that sort of thing.
That's right. I think it's a common misunderstanding to think of people who have died by suicide as cowardly or weak. That's just not accurate. And indeed, to do something as fearsome and as daunting as death by suicide, you do require a kind of fearlessness in order to carry through.
Yeah. When we come back, we're going to talk about the warning signs that cops on you and kick your door down. They're going to talk to you. They're going to ask you some questions. There may be going to be a voice of reason when maybe you're not being very reasonable. Now, Dr. Joyner has a new theory for identifying typical suicide personality, and I want to also give you some more hopeful points to consider if you're thinking about suicide. Now, this fearlessness thing that you talk about, how is that best spotted by a loved one, a family member? What's the best way to recognize this?
One is the one involving reckless behavior.
Yeah, the high-risk behaviors without regard for their personal safety.
Exactly. And then the other is the one having to do with trying to access means for self-harm, someone who's looking for guns or knives or poisons, etc. That's a behavior that's usually stopped by this innate fear that we have. When somebody's overcome that fear so that they're approaching suicide to that degree, that's a dangerous situation.
John, what do you want to say?
Well, there were two things that you said, Dr. Joyner, that I think were probably true for Casey before she died. One was, I think she had a thought in her head of, Mom and Dad would be better off without me. And number two, nobody will miss me when I die.
Right. Right. And the tragedy is that those are mistaken perceptions, and they just weren't true, but the double tragedy is that Casey did not know that.
That's one of the things that I want you to think about if this is something that makes sense to you or if you're talking to somebody that's at risk. Suicidal crises are almost always temporary. I mean, if you talk to somebody who thought about it and you're discussing it with them a month later or 2 months later or later in therapy, they look back and go, oh, you know, that seems so profound at the time, and I really can't even remember the details about it now, but at the point it could have resulted in the end of their life.
That's right, and it does. As you pointed out, 80 to 90 times every day in the U.S. we lose somebody. Yeah. And if those folks would just have the support and the access to access good mental health care, a lot of lives could be saved that way.
Another point is that problems are seldom as great as they appear at first glance.
That's right, and we found in our research that suicide rates go way down at times of national crisis. They go down, not up, at times of national crisis, and we think it's because the national crisis puts everything into perspective. It puts personal problems into a larger perspective, and people tend not to act on suicidal desires during those times.
Now, reasons for living can help sustain a person in pain as well, because, as John was saying, it's like, nobody will miss me if I'm gone. It's important that you talk to yourself or others about what role you do play in this world and what contribution you make. And most importantly, Doctor, isn't it important to not get isolated, to talk to people about this, friends, church, family, somewhere, to talk about your pain?
It's just human nature. We're very, very social creatures, and we just have a basic fundamental need to connect and to belong, and to deny that need or to thwart it or not to nurture it usually leads to some sort of negative outcome.
Well, Dr. Joyner also has a couple of other things to keep an eye out for, and one of them, you say, is pay attention when someone starts giving away all of their prized possessions.
When people are doing things like that, it's not a show. They're not just talking. It's a dangerous warning sign, and people need to act on it.
But the key is getting the person some help,
yes,
and it's
sir.
available.
Yes, sir. It's a problem that needs to be worked throughout the whole process. We're not talking about days and weeks. We're talking about months and years of connecting to vulnerable people and making sure that they have the care that they need and deserve.
Yeah. Now, we're going to talk about...
I'm going to go ahead and stop it right there. But I think that it's something that as we went into COVID well over a year ago, knowing that we had this giant health pandemic, that we had this first wave of COVID, and we had this second wave of a financial crisis, and this third wave of a mental health crisis. There were a lot of media reports saying that suicide rates were skyrocketing. And in some communities, that was true. The school district throughout Las Vegas saw a huge spike in youth suicides. But for the most part, across the United States, we did not see that huge spike in suicide rates. And it can be anticipated that it might happen as we come out of this global pandemic, if the correct supports aren't there. But we have a great opportunity, because when we know what the risk factors are, having a family history of mental health or suicide, having a personal history of suicide attempts or a personal history of suicidal ideation, substance use, trauma, isolation, impulsive or aggressive tendencies, if they've experienced loss, whether it's a relationship, social status, something within their employment or financial loss, whether it's their own or whether it's their family, something that impacts them, if they have access to lethal means. So when we're looking at Dr. Joyner's Venn diagram here, a person can live with that desire for suicide. They can feel alone and they can feel like a burden and never make that attempt on their life if they don't build the capacity for suicide. But one of the caveats to that is if they have access to lethal means, if they have access to a firearm, if they have access to large quantity of medication. Physical illness is another big risk factor, and then barriers to any of these types of care. But protective factors can counterbalance this. I share Speedy's story and share that he had a lot of risk factors. He had a very high ACE score, and struggled with his own mental health and substance use. There were all kinds of risk factors and very few protective factors. But if we think of this as a balance beam, it should weigh itself out. And so wherever we can build protective factors like clinical care for both mental, physical, and substance use disorders, easy access to those clinical interventions and supports, whatever we can do to help families and communities connect, support for medical and mental health care relationships, problem-solving skills, conflict resolution, and nonviolent ways of handling disputes, making sure that cultural and religious beliefs discourage suicide, and do so in a way that still allows for folks to feel connected, and trusted adults being one of the most powerful pieces in a young person's life. So another trivia question. This one's for 400 points. Okay, we got a question that we can address quickly since we're looking at it right here. ACEs does fit into risk factors. ACEs would be trauma. Adverse childhood experiences would be trauma. And if I were to highlight the biggest risk factor here, we're talking about trauma. If we're highlighting the biggest protective factor, it's trusted adults or connection. Great question. So here is our trivia question. What are appropriate words to use when talking about suicide? We heard Dr. Phil use a word in context that we don't any longer. So what do we say? Direct language. Awesome. Are you thinking of suicide? Great. Direct language, direct, appropriate language. Okay, the answer is died by suicide. We say things like they took their own life, they ended their life. We talk about it directly. We heard Dr. Phil say that they committed suicide. And that's something that we are trying to stay away from because it continues to stigmatize suicide as a means of death. In that we commit crimes, we commit sins, and that if suicide truly is related to these mental health conditions and these significant traumas in life, we want to move away from that and to destigmatize it so that we can treat it like a preventable and solvable problem. So we just want to stay away from the term committed suicide and successfully completed suicide. Those phrases can have a huge impact on the way we message and understand. Okay, here's another one for 400 points. Before starting a conversation with someone that you're concerned about, there are several things we can do to prepare. What should we do to prepare for this conversation? Any ideas? No resources that are available. Yes, resources ready. Be present or present questions. Yep. Also be present. Know how to help. Great ideas. All right. Here's some other ideas. Prepare that list of behaviors that you've been observing with them and that you're worried about. Using a statement like "I've noticed" is a very neutral statement where you can describe what's been concerning and give them some time to reflect, to either acknowledge that that's been happening, or perhaps they're not even aware that it's taking place. You need to practice what you're going to say. If we were together, we would practice saying some of these phrases out loud. And so your homework is to spend some time asking the question directly to yourself in the mirror. Try to do so when there's no one else around, but build that muscle memory and be ready to practice it. Saying it, how would you get this out? Because for some of us, it can be a very crippling feeling. It can be one of the most intimate things you could ever ask another person. Have a list of crisis resources. You guys have already programmed your phone with a crisis hotline and crisis text line. Think about what you will say or do depending on how the person responds. We need to think about what would these, answers do? What would they do emotionally to us, and how would that help us pivot in the conversation? Plan the conversation for a time when you're not going to be in a hurry and you can spend time with them. We can support someone while they find their reasons for living by sharing hope and letting them know that they're not alone. Just by having this conversation, you're planting the seed of hope. Our role is less about fixing the problem or convincing them to stay, and more about just being present and listening and helping them search for those reasons for living. Call the national hotline and let them guide the conversation if you ever get stuck. So we've looked at some of the signs. We're going to find the words. How do we start the conversation? We need to listen. We want to express that concern. I've noticed statements. We want to reassure them. We want to let them know that you're there to help them get help. And there are some things that we don't want to say. So we want to be prepared. A list of resources is always really helpful. If you've taken any of our longer courses, Mental Health First Aid has a great resource. And so on the Speedy Foundation's website, it's currently being revised, but we have compiled Region 4 and Region 3 resources. I think there's also a Region 1 resource, and various communities have self-help rescue manuals. So reaching out to your local crisis center to see what resource list they have is a great first step, or reach out to me and I can send you what I have available for your region. Practice what you're going to say and plan that conversation. Mention the signs that prompted you to ask. I've noticed. Make it clear that this isn't just coming out of the blue. Like it's something that you're genuinely concerned about. It can help them understand that it's not something that they can necessarily shrug off. And we're going to ask them directly. When we speak directly about suicide, it lets that person know that you're willing to talk about suicide. There's so much stigma. And for somebody who already feels isolated and they already feel like a burden, there's no way that they're going to be like, hey, hey, you know what? I've really been struggling. I know I haven't been coming over for Sunday night dinner, and I'm totally not coming to softball. And you know why? It's because I'm suicidal. That would be a lot more of a burden on someone if they don't know that they're open to it. And that's a lot of self-awareness that for somebody who's struggling with thoughts of suicide, they might not have. When we think about drunk driving rates in the United States, back in the 80s, there were a lot of different campaigns out there established to reduce drunk driving rates. But it wasn't until we put the onus on the friend and the campaign became Friends Don't Let Friends Drive Drunk. That's when things changed. That's when our drunk driving rates changed. It said, recognize that they're inebriated. You are responsible for taking their keys, getting them home safely, and we'll handle the rest of it tomorrow. It's the same thing with suicide. Assume that you're the only one who is willing to step forward. You're the only one who noticed. Let's approach them in that same fashion. It helps the person understand that you are willing to take that risk to talk about this very emotional and uncomfortable topic for so many. It does not put the idea in someone's head. We ask the question directly, are you thinking about suicide? Are you thinking about ending your life? Remove any urges to be defensive. That is a wonderful piece to add in. Absolutely. This is the question I would like for you to practice when you have a chance, when you are alone. Because if the answer is yes, we're going to take a little bit of a suicide risk assessment. We ask the question directly, and so then we ask about planning. We're asking very specific questions that are open-ended. Have you thought about how you would kill yourself? Have you decided when you would do it? And have you done anything to get the things you need to kill yourself? Notice we're not asking them, do you have a gun in the home? Or are you stockpiling pills? That might plant an idea, because it could be that this person's like, no, I don't have a timeline. I don't have a method. I just don't want to be here anymore. And so these open-ended but very specific questions help us understand the urgency in and the sophistication of their planning. If the answer is yes, they do have an urgent plan. Yes, they've procured the means, or maybe the suicide attempt is already underway. That's when we need to call 911. We want to tell the dispatcher that the person is at risk for suicide, and if available, send mobile crisis, send a CIT trained officer. CIT trained officers are becoming more and more common in the state of Idaho. CIT stands for Crisis Intervention Training. It's a 40-hour evidence-based program. It's also called the Memphis model. And so I know that throughout the state, more officers are being trained in that. You can also ask for maybe a plainclothes officer to respond. There are also crisis centers. If the level of planning isn't as extreme, if we have the opportunity to avoid law enforcement and avoid the emergency room, taking someone who's 18 and older to one of Idaho's crisis centers is another great way to get them connected to help. connecting the person to appropriate professional help. We're becoming gatekeepers. We are not becoming licensed clinicians. We don't have to solve the underlying problem. We want to keep that person safe for right now. We want to listen, express concern, and be reassuring. We want to listen for their reasons that they might have for both living and for dying. Validate that they are considering both options. Highlight that living is still an option for them. Living can still be an option. Let the person know that you care and that you're genuinely concerned about them right now, and you're taking the situation seriously. This is a short segment from Brené Brown on the power of empathy. And so when we're talking about finding the words, sometimes it's not words. Sometimes it's just your presence.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. Yeah. And we do it all the time, because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
So as a suicide prevention gatekeeper, we can create that connection. We can't necessarily solve the underlying problem. We can empathize, we can connect someone to care. We don't want to say, you're not thinking about suicide, are you? Or you're not going to do something stupid, are you? We don't want to ask in any way that doesn't invite the truth. We have to keep the door open and help lower the anxieties. Don't ever tell the person to do it. You may have feelings, you might get frustrated or angry, but that's a very dangerous thing to say that we might sometimes say in a very heated moment. And we don't want to promise secrecy. The person may say that they don't want you to tell anyone else about it or how they plan to end their life, but this is really something we cannot keep secret, especially if we are working with a minor. Instead, use these phrases. There is a handout that goes along with this presentation. If it's not in here, email me and I can get it out to you. But it's a script. It's a know the signs script. Here are some phrases. I care about you too much to keep a secret like this. Extra help is needed. Let's work together to get you connected to someone who can help. Or like Brené Brown, I don't even know what to say right now. I'm just so glad you told. Focus on safety. You know, we're talked a little bit about asking those questions on planning, but, you know, have you thought about how you would kill yourself? Have you decided when you would do it? Have you done the things necessary you need to get to kill yourself? Removing some of the lethal means from the vicinity can be very helpful, keeping that person safe. Sometimes you're in a position to do that and sometimes you're not. So that would be something where if you do reach out to law enforcement, that's something that they have within their power to do. And disposing of things in a safe receptacle is also very important. Get help. I understand it feels awkward to go see a counselor, but there is a phone number we can call to talk to somebody. Maybe they can help. You know, using the hotline, the text line, reaching out to our crisis centers throughout the state. There's information that can be found at the Health and Welfare's website. But anytime we feel that a situation is critical, we want to take that person to the emergency room or a walk-in psychiatric crisis center or by calling 911. Here's more on those crisis centers throughout the state. I know that for some groups, I know that I've spoken with law enforcement agents from across the state when someone is in crisis. And I don't think that everyone knows that this is an option. This is a piece where if we don't need to involve jail and we don't need to involve the emergency room, we can connect with this. One of the biggest problems is transportation. It can be very hard to transport someone. So for an officer in McCall, Idaho, to transport someone to the nearest center, which would be Pathways in Boise, that is a long commute. And for somebody who is in an escalated behavioral health crisis or a suicidal crisis, that's not always available. But we do need to know that this is a resource and it's a piece that can help us de-escalate and keep it at the lowest level. So here's our final trivia question. True or false? If someone wants to die by suicide, they will find a way, no matter what we do, to limit their access to lethal means. For 100 points, true or false? False, false, false. Getting a lot of falses. All right. The answer is false. Helpful facts. People in suicidal crisis often make a plan, and when the means identified in their plan isn't available, they don't go on to attempt by different means. 90% of people who survive a suicide attempt will not go on to die by suicide. That the means matters. The highly lethal means, such as firearms, when those are readily available, that can create a much higher risk, which is why we see in Idaho firearms at such a significantly higher rate than nationwide. It's not anti-gun, it's firearm safety. We have rules when using firearms, and being prepared to recognize the warning signs that someone is suicidal, to be prepared to act, to know the signs, to be able to find the words, and then to reach out and get help. It's just as important as anything else when it comes to firearms. So what I would like for you guys to do right now is to tally up your points and go ahead and put those in the chat box. And I've got just a couple more slides to run through and then we'll take some questions. So thinking about safeguarding your home. We baby-proof our homes when we bring home a baby. We need to think about the same thing as far as keeping our family members safe. We need to create supportive relationships. We need to keep our medications locked and limited. There's drug take-back days. There's drop locations all across the state. We need to get those medications out of the house. There's dissolving bags. Also purchasing medication in blister packs as opposed to Costco-sized bottles, Costco-sized blister packs, because if somebody in crisis has to sit there and pop those pills out of the blister packs, that is going to put time and distance between them and that means of a suicide. Firearms, again, lock, limit, and remove in times of crisis. Remove the firearms until things improve. There's a lot that we can do to suicide-proof our home. The other piece that I just realized I didn't put in here is safety planning. So once you get that person connected to care, whether it's through the hotline, whether it's through the emergency room or a crisis center, a safety plan should be written. If they're discharged from the emergency room, they need to come away with a safety plan. And the more you can talk about that safety plan, where we're identifying their triggers, their potential risk factors, what are their protective factors? One of the last questions on these safety plans is what anchors you to life? who are your supports, and why, why are you connected to life? Knowing what binds them here can help us as they continue to recover outside of the initial crisis. There's no way I can cover everything in 1 hour, or an assist training takes 2 full days and you still don't cover everything. And so I encourage you to take a calm training, counseling on access to lethal means, to really understand that piece a lot more fully. And this is a quick video from the Mayo Clinic on teens and young adults.
I have my ups and downs, just like anybody else.
Maybe more than anybody else.
I can be hard to figure out.
And I like my privacy.
I don't want you looking over my shoulder all the time.
But you know your kid better than anybody else. And if you think he's acting different than usual...
Acting really down, crying all the time for no good reason.
Or getting really mad.
Not able to sleep, or sleeping too much.
Shutting her friends out or giving her stuff away.
Acting reckless, drinking, using drugs, staying out late.
Suddenly not doing stuff he used to love.
Or doing stuff that's just not like him.
It might be nothing to worry about. It might just be high school.
Or it might be something more. He might be depressed.
Not just feeling down, really depressed.
It might be that your kid is thinking about killing himself.
It happens. More than you think. More than it should.
And people say, I had no idea.
I thought it was just a phase he was going through.
I never thought she'd do it.
I wish he'd come to me.
I wish he'd said something.
I wish I'd said something.
When it's too late. So if you think your kid's acting different, if she seems like a different person, say something.
Say, what's wrong? How can I help?
And ask straight out. Are you thinking about killing yourself?
It doesn't hurt to ask. In fact, it helps.
When people are thinking about killing themselves, they want somebody to ask.
They want somebody to care.
Maybe you're afraid you'll make it worse if you ask. Like, you'll put the idea in their head.
Believe me, it doesn't work that way.
It doesn't hurt to ask.
In fact, the best way to keep a teenager from killing herself is to ask, are you thinking about killing yourself?
And what if they say yes?
Or maybe.
Or sometimes.
Well, here's what you don't say.
That's crazy.
Don't be such a drama queen.
You're making too much of this.
That boy's not worth killing
Yourself.
over.
That's not going to solve anything.
You're just trying to get attention.
You're not going to kill yourself.
What you do say is,
I'm sorry you're feeling so bad.
How can I help?
We'll get through this together.
Let's keep you safe.
A lot of people think about killing themselves. Adults and kids.
most of them never try it, but some of them do. So if your kid says,
I'd be better off dead.
I can't live with this.
I'm gonna kill myself,
take her seriously. Find someone she can talk to about it. Someone who knows how to help.
Sometimes kids want to kill themselves because something happened. A breakup, a failure.
But sometimes it goes deeper, and it's not going to go away by itself.
Get some help. Talk to your doctor.
Or a counselor at school.
Or your minister.
but don't just let it drop.
And make sure that your kid always has someone to turn to. Someone he trusts.
Make a list together, right then. 3, 4, 5 names.
Put a suicide hotline number on there too.
Have him keep that list in his wallet, so he always knows where to turn.
Make sure your home is safe.
If you have pills she could use to hurt herself, lock them up.
If you have a gun, don't just lock it up. Get it out of the house. The bullets, too.
And one more thing. If you think your kid might be about to hurt himself, don't leave him alone.
Take him to the emergency room.
Call 911 if you have to.
We all have our ups and downs, but sometimes it's more than that.
If you think something's wrong, the only way to find out is to ask.
Ask straight out. Are you thinking about killing yourself?
Don't wait until you're sure. Trust your gut.
Because it never hurts to ask.
And it can make a big difference.
All the difference.
In your kid's life.
All right. So, wrapping things up, let's check back in. How are you feeling now? This has not been the most uplifting hour. So just take a couple minutes and think, are you where you came in? Are you feeling more hopeful? Are you feeling a little bit more stormy? I need you to know that the best thing that we can do is be direct and not fear this topic. That any action that we take plants a seed of hope in someone else's life. So thank you for attending. What I'm asking you to do is, this call to action is to help yourself. If anything came up, if anyone came to mind, reach out and get that help. Have a conversation for yourself or reach out to someone that potentially is struggling. Prepare those resources and hopefully you never have to use them. Spread the word. You can invite others to attend these types of gatekeeper trainings. You can host a training with an organization that you're a part of. You can follow the Speedy Foundation on social media. Go to our website to find additional resources, subscribe to our newsletter, and that will show when we have some upcoming trainings that are more in depth. You're always welcome to reach out to me. My email is shannon@thespeedyfoundation.org. I'm wondering if there's anyone besides Michelle and Kim who look like they're tied at 2,250 points. Anybody beat that? I'm going to send Kim and Michelle, if you guys want to drop your your addresses into the chat box, you can send them to me privately. I'll send you guys Speedy Foundation beanies that are perfect for summertime. But the Olympics are coming up, and so we've got our Olympic colored beanies, and it's also Pride Month. So I'm happy to send those your way. And I know that we're short on time, but I'm happy to take any questions. I know that we have a link in the chat box to the survey as well. Please send feedback. You're welcome. Thank you.
It doesn't look like we have any questions, and we are out of time. So thank you very much, Shannon. And
thank you.
If you can all take a minute for this session and for the others to fill out the feedback form, we do appreciate it. And we'll see you tomorrow. Thanks.